Welcome to the video supplement for McGraw-Hill's medical simulation.
Today we look at the scenario, there's an elephant sitting on my chest. Our patient is Billy Zebra, who is 59 years old. He complains of severe chest pain and shortness of breath. This simulation objective is to demonstrate an EKG showing an acute myocardial infarction. Your goals should include properly placing the leads and performing a 3-lead EKG.
Along with the essential clinical skills, your instructors will be looking for washing your hands, wearing your gloves, and demonstrating a proper introduction to your patient, including checking the patient name and birthday on the ID bracelet with that on the medical records. Now let's join our healthcare professional Rebecca and her student Holly as we learn how to assess an acute myocardial infarction.
Hi, my name is Rebecca. I'm the instructor, and this is Holly. She's a student, and we're going to demonstrate a 3-lead EKG on a patient with an acute myocardial infarction. Okay, Holly, go ahead and introduce yourself to the patient.
Okay. Mr. Zebra, my name's Holly, and I'm a student, and this is my instructor, Rebecca. How are you feeling today?
I feel like an elephant on my chest.
All right, don't worry, we're going to take care of you.
In this scenario, we're going to demonstrate a 3-lead EKG on a patient with an acute myocardial infarction. Can you tell me a little bit about the patient?
Yes. Our patient today is Bill Zebra. He's 59 years old, and he's complaining of substernal pain radiating from his jaw down to his left arm.
All right, for a 3-lead EKG, I'm going to show you how to put the leads on. We have 3 leads, red, white, and black, and they're all labeled. We have the one that says RA for the right arm, and we're going to put that below the patient's right clavicle. LA for left arm, below the left clavicle. And LL for left leg, to the left of the patient's umbilicus. Let's take a quick look at a normal EKG, all right? The P wave is atrial depolarization. The QRS complex is ventricular depolarization with atrial repolarization, and the T wave is ventricular repolarization. And the U wave is usually pathologic, sometimes demonstrating hyperkalemia. And today we want to pay close attention to the ST segment based on our patient's history. Okay, now we're going to run an EKG. Turn on the monitor, and then after we press this button, we're going to count for 6 seconds.
Okay.
Press it again, and then that'll be our strip. 1, 2, 3, 4, 5, 6. Let's go ahead and take that to your medical record.
Okay.
Here's a blown up version, and they look alike.
Okay.
And do you notice the ST segment is elevated? That's indication of an acute myocardial infarction.
Also known as a heart attack, it often happens when the arteries going to the heart are blocked and blood supply is slowed.
Notice this says 60. Let's confirm that with our EKG. Now we have 4 large boxes in between the R's, okay, the peaks, and then we have 2 half boxes right here. So 4 plus 2 halves is 5. We can take 5, multiply that by 0.2, you get 1.0. 1 times 60 is 60, so we have 60 beats per minute. And another way to determine that is to take 300 divided by 5 large boxes, and we get 60. And let's confirm this one last time with checking the patient's radial pulse.
Okay.
So you got your second hand? All right, count for 15 seconds. What'd you get?
15.
All right, multiply that by 4.
60.
All right, 60 beats per minute. And this is how you will assess an acute myocardial infarction on a Laerdal simulator.
Thanks for watching, and we look forward to your success in this demonstration. I'm Lauren Corbett from McGraw-Hill's Medical Simulation Work Text.